Good evening and welcome back to our second segment on malpractice. Two terrific guests, and if you saw the first, segment, you saw how complicated this issue is. And welcome back again, my two guests, Attorney Mike Koskoff. Mike is a personal injury lawyer who specializes in malpractice. His main office is in Bridgeport, Koskoff and Beater. He's lectured widely. He's a member of the Inner Circle of Advocates, 100 of the top plaintiff lawyers in the country, and a very well-positioned guy to know what he's talking about. My other guest, of course, is Dr. Rob Levine. Bob is a neurologist. Last week, I upped him to a neurosurgeon. He's a neurologist.
Demoted. Demoted.
Bob is a neurologist at Norwalk Hospital. He's also an associate professor of clinical medicine at Yale University in the med school. Bob has written a book, Shock Therapy for the American Health System, which has some great innovative ideas in it. Welcome back again, guys. That was a great first segment that we had.
But we didn't hear enough about Bob's book. Because that's what I want to hear about. I'm going to go out and buy it on Amazon as soon as I get a chance, because it is very interesting, because I think in a way what you've written about, Bob, really does relate to the whole malpractice situation as well as the rest of the problems with healthcare.
Healthcare
right?
in general, right? Because I think a lot needs to be done to reform it, and what's going on right now in Washington is not going to do the job.
Well, go ahead, Bob. Why don't you take off with that? What don't you like about what's going on in Washington?
Well, I think the most important thing is the cost escalation of care, and what's the plan in Washington does not address cost whatsoever. It talks about paying for people who right now don't have insurance coverage, but it doesn't cost about take on healthcare inflation. And I think that's very dangerous for the country. We can't afford the kind of care that we have right now. There are a lot of excesses in the system. We could pay for healthcare reform without any additional taxes, without any increased government spending, without adding to the national debt if we took the right pathway. And that's in my book, Shock Therapy for the American Healthcare System.
And I guess we get back to...
And that's, by the way, one area where I think we agree on a lot of the things, that there's a lot of things that can be done to improve our system, because we have real problems with delivering health care in this country. Bob's concerned with the cost. I know he agrees with me here, too, that we're concerned with patient safety. And with patients getting good, consistent quality of medical care.
Right. Well, we're gonna do more of these shows, because this is such a great. And be patient with me if I sometimes seem to get lost, because it's such a hotly charged issue. There is such a thing. I don't know how else to call it. We hear this word, Mike, defensive medicine. And I was trying to think of last week's segment. We were talking. Bob had talked about his personal experience, and you had mentioned the word fear and threat, and doctors. I'm just trying to put a human face on this, and maybe I'm not very good at this, but this fear. Bob's expressed his feeling about it. How do you think doctors shouldn't be feared? Shouldn't be dread a malpractice?
Absolutely, they should not.
They
should not be afraid. What they should be doing is practicing good quality medicine, and that should be their concern. They shouldn't be concerned with themselves. They should be concerned with their patients. They should be concerned with treating their patients properly. If some of them get sued, and some will, partly because there are problems. I mean, there are inevitably some people are going to get sued who perhaps shouldn't have to, but that's why they have insurance.
Who did the right thing, so to speak.
Who did the right things. And the system, as it works, is not designed. The system is a system whereby a decision is going to be made at the end of the case.
Yeah.
And most of the time, the decision is the right decision. And the decision for those doctors who didn't do wrong, is that they will be exonerated. The same way as a person who's driving an automobile can get sued, and you can get sued for driving an automobile, and it could be, a suit that doesn't have merit, and at the end of the suit, you're going to be exonerated. But that's why we have juries, to decide the complicated important
Yeah.
factors. I mean, people get accused of crimes who go to jail for years before they're exonerated by the jury. So although I feel sorry for Bob when he's gotten sued on a case which sounds to me like it had absolutely no merit, and I do feel sorry for anyone having to go through that. It's not an easy experience. I also feel sorry for the hundreds of patients who live with disabling injuries, paralysis, brain damage, and deaths of children and other people due to bad medical care. So inevitably,
Right.
that's part of the burden we as professionals carry, unfortunately. I carry it as a lawyer. I mean, I know if I lose a statute of limitations on some patient, and that can happen, and if I do it, or if I don't bring the right cause of action and get sued, I know I can be sued for it, and I should be sued for it.
But, you know, part of the problem is that doctors are fearful because a lot of them are doing the right thing and they haven't done anything wrong, but a maloccurrence happens. Something goes wrong and the doctors are sued because something is wrong, even though it's not their fault. And the attorneys tend to bring patients into the courtroom who are damaged in some way, who are paralyzed, who are brain damaged, and show the jury these poor people who have major problems and say, look at these poor people, look what the doctors did to them. And on an emotional basis, the jury may decide in favor of plaintiffs who have injuries have occurred, but that doesn't necessarily mean the physician's at fault. And we know that in a significant number of cases, in that recent article in the New England Journal that we discussed, 28% of patients 28% of cases where there was no evidence of medical negligence were decided in favor of the plaintiffs. And that happens not infrequently. And the opposite is also true. There are cases where there is medical negligence and the patients don't have an award in their favor.
You know what, Ed? You kind of warned us beforehand not to throw too many statistics around, and I kind of agree with that.
And you guys
I'll
have
tell
been
you,
pretty good.
we've been pretty good, but now I think,
Yeah,
Bob, you got yourself into a statistical box, because on the one hand, you say that these people get before juries, and the juries are so sympathetic, they give money to people even when there's no merit to it. And then, last week you said, in 70% of cases that go to jury, they come out for the defendant. So apparently, jurors are not all that sympathetic. I mean, I think the medical profession has done a real job on spreading word and fear among the jurors that doctors are going to be sued for something they didn't do, and that's a valid argument that jurors should be conscious of. But I don't think, and it has never been my experience, that jurors act on sympathy, and no one who has looked at it, no one who is seriously, I mean, again, I'll refer you to Tom Baker's book, the University of Pennsylvania professor, who has analyzed this, and nobody who's really looked at this has come to the conclusion that so, although I do agree that doctors fear that that's so. Doctors fear that some
somebody
sympathetic
like Bob
person
sort of gets caught in you know, what happens to somebody like Bob? He's just yeah, I know, that's too bad.
It is
I
too
mean,
bad. It is too
we
bad.
got to move a little bit beyond that.
But we got to move beyond yourself on this thing.
Right, but we know that a significant percentage of patients, a significant percentage of cases that are without merit are decided for the plaintiffs, and the opposite is also.
No, we don't know that. We don't know that. We disagree with that. That's one of our points of real disagreement. That is again a situation where doctors sit down and look at a medical chart and they say, well, this case has merit, this case doesn't. But they're not seeing the whole picture, and they're not getting the evidence from the witnesses. They're not getting the discussion from conflicting experts.
So that's why you need a law